Good afternoon. My name's Maria Pippidis. I'm with the University of Delaware Cooperative Extension, and I'm so pleased that you all have joined us today. Today's talk is Smart Choice Health Insurance, and specifically for state employees, and today's May 1st. And I'm really pleased that the Sussex County Health Coalition has helped to sponsor this and help get the word out. So I'm going to jump right in because there's a lot to cover. This is me. I'm Maria, and I am an accredited financial counselor and a financial fitness coach. I've been with the Cooperative Extension here in Delaware for a long time, I'll just say, and have been working on health insurance literacy programming for the last 10 years. And I'm really pleased to sort of begin to integrate in information from the state side to this program that I've been doing for a long time called Smart Choice Health Insurance. So today's goals really are to help you understand why health insurance isn't so important. That's the easy one. We're going to learn a little bit about some of the resources that are available to help you kind of compare plans, but also understand some of the costs and also identify information to really help you make a smart choice. Crystal sent out a few handouts yesterday in the email that would include the important words to know document, which is sort of a good kind of basic glossary of health insurance terms. We'll be going through some of those today. The My Smart Choice Health Insurance Workbook, which is a fairly large 20 some odd page document. We'll be going through that at the end of the presentation, how you can use that workbook to make a smart choice. And then lastly, a listing of reliable resources from the internet. So I like to organize my presentation sort of about questions, and kind of we'll be going through these questions as we go through the presentation today. So why do I need health insurance? What are some considerations I need to think about as I choose a health insurance plan that might be best for me? What options are out there? You know, how do I choose the right plan? And, you know, putting all those together really help you to make a smart choice. So I thought we would start out today really with a little Who Wants to Be a Millionaire game that gets us kind of introduced to kind of important health insurance terms. So here's our first question, our $1,000 question. And here are our answers, right? So the $1,000 question is the amount that must be paid for your health insurance. You and your employer usually pay it monthly, quarterly, or yearly. In the case of the state, we're paying it through every pay, typically. And so, okay, what would be the answer? And hopefully you have said premium. That was an easy one. That's why it's the $1,000 question. All right, our $5,000 question. The amount you pay each time you visit the doctor, have lab work, or a diagnostic test. Co-insurance, co-payment, deductible, or receipt. And hopefully you would have said co-payment. And I hope you're keeping score, how many you're getting right. All right, our $10,000 question. The amount you owe for health insurance services that your health insurance plan covers before your health insurance or plan begins to pay. All right, and our options are co-insurance, co-payment, deductible, and allowable amount. Now, this starts to get into the trickier questions. I'm hoping that you all have said, dun dun, deductible. So I just want to dig a little deeper into this question from the perspective of the question itself, the amount you owe for health care services, and then we have that your health insurance plan covers. And I added that in there because there's sometimes aspects of healthcare services that are not covered by the health insurance plan. And so what you may pay for those services can't count towards the deductible in this case. You end up paying the deductible before your insurance begins to pay. All right, how about our $50,000 question? Your share of the costs of a covered health insurance covered healthcare service calculated as a percent of the allowed amount for the service. This one is one of those things that people get confused about, and the answer is coinsurance. So what this means is, and we'll see it in the outline of the plans in a little bit, but when we look at those plans and we see where the health insurance provider may cover, say, 90% of a service, and we would be responsible for a 10% of that service, that is considered a coinsurance, and it's calculated as a percent of the allowed amount. All right, our $2,500 question: the maximum amount paid to a provider and is used as a basis for covered healthcare expenses. This may be called eligible expense, payment allowance, or negotiated rate, and our choices are allowed amount, deductible, coinsurance, or out-of-pocket maximum. And in this case, the answer is an allowed amount. So what does that mean? So as a healthcare provider kind of negotiates a contract with the health insurance company, there is a negotiated or an allowed rate that that healthcare provider can charge. So for example, if I go to the doctor, my primary care physician, if I go to the primary care physician, they have negotiated with the insurance company that they will only be reimbursed, say, $100, right? Now they may bill for $150, but the allowed amount is what they're going to end up being paid. So that's called the allowed amount, the negotiated rate, those sorts of things. So when we go back up here to the previous question, in my example of that doctor charging, only being allowed a $100 payment, if there's a co-insurance on that, say of 10%, I would be responsible for $10 of that $100 payment, and the health insurance company would cover that 90%. So hopefully that's clear. All right, our $500,000 question, we're getting close to the end here. When a provider bills you for the difference between the provider's charge and the allowed amount, for example, if a provider's charge is $100 and the allowed amount is $70, the provider may bill you for the remaining $30. But a preferred provider may not bill you for that additional amount of covered services. So what is that called? Out-of-pocket maximum, coinsurance, receipt, or balance billing? And the answer is balance billing. This typically comes into play if we go to a provider that is out of network. We'll talk a little bit more about what that means as we take a look at the plans. But if we go to an out-of-network provider, they are allowed to bill us for the difference between that allowed amount and what they are actually charging. $750,000 question. A type of health insurance plan that has a network requires a primary care physician and referrals to specialists, and typically is preventative in focus, and typically also has the lowest premiums. Oh, and my answers are not coming up, but and these are the acronyms for the names of those plans: a POS, an EPO, a PPO, or a HMO. And the answer is HMO, or a health maintenance organization. Understanding the type of plans that is being offered to you is an important part of the decision-making process. And so I'm going to delve into this a little bit more right here, right now, before we get to the million-dollar question. In this little chart, I have those different types of plans listed: the HMO, the POS, the EPO, and the PPO, right? So HMO is Health Maintenance Organization. The POS is exclusive provider organization, and the PPO is the preferred provider organization. And so what I've got here in the columns then is some of the rules and the differences between each of these types of plans. And so you can see in terms of costs, it kind of runs between from the HMO being the least costly to the PPO typically being more costly in terms of the premium. sort of the same in our out-of-pocket maximum, and we're going to talk a little bit about what that means in a second. Primary care physician, you know, in an HMO, you have to have a primary care physician, and obviously it needs to be in that network. Really, in all plans, typically you need to have a primary care physician. But in the next column where we talk about referrals to specialists, the only plan, the HMO, is the one where you would need a referral from your primary care physician in order to access specialists. In the other plans, you can directly make appointments with those specialists without going through your primary care physician. And the other important consideration for different plans is whether or not you are allowed to go out of network and have the health insurance plan cover some of those charges. So you can see for the health maintenance organization and the EPO, or the exclusive provider organization, you really only have in-network options. And if you choose to go out of network, you will pay the full cost of accessing those healthcare providers. Unless it's an emergency, right? You're out traveling and you have an accident and you go to the ER. That's a different story. But in general, you would be paying sort of the billing rate of the provider if you go out of network. The other two options, the PPO and the POS, typically have an out of network option. You will pay more, but the insurance company will pay some if you go out of network. So hopefully that's a little clearer. All right, our last question, right? Our million-dollar question. Premiums, co-payments, co-insurance, and the deductibles are all examples of receipts, out-of-pocket costs, flexible expenses, or unknown costs. And the answer, of course, is out-of-pocket costs. Meaning these are all things that we are going to have to pay in order to access our health care. I hope you did really well. The important words to know document that I gave you has all of those words in there and more. So if you have questions, please refer to that. Let's go into the why, right? Why is health insurance so important? So maybe you can write in the chat. This is an easy one, right? All right, so here are some of the reasons I came up with, right? It provides some peace of mind, right? Having health insurance knows that you know that you can access care when you need it, especially if it's an emergency or an accident, something kind of unexpected. You know that some of your financial burden will be covered by the insurance. It, in that way, can protect your family's financial future, right? So you're paying a little bit along the way in order to have risk prevention, right? That's what they call it. We have insurance for risk prevention. Kind of helps mitigate some of the risk and the cost that may occur in our healthcare expenses. Health and wellness services and programs. So that's a lot about being able to access care in a way when you need it, right? And some plans have a lot of preventative things that are offered as part of their plan, as well as the wellness services. And especially in our state plans, they've really done a nice job of engaging programs that help us meet some of our health care needs. And then lastly, I just like to add this because we know from the research that people who have insurance and use it, meaning they have insurance and they actually go to the doctor when they need healthcare services, have better health outcomes, have better health outcomes. All right, so what are some of the things that we need to be thinking about for our what question? You know, what options are available to me and what do I need to compare or consider when trying to make a smart choice? So one of the things that we can do, right, as state employees is find information about the plans right on our Delaware Department of Human Resources pages. And there's the URL that you can go to. This is what it looks like for this year. And really one of the first steps is to figure out, well, which of your group do you belong to? And to recognize that open enrollment is between May 4th and May 20th of this year. And then the plan year runs, July 1 to June 30th. First step would be going to this page and then determining which group that you belong to and clicking on that tool. So I pulled this directly from the website. This outlines then the different choices that we have as state employees. And you can see we have plans from Highmark, Delaware and Aetna, right? So we have 2 plans from each health insurance provider. In this first row, talks a little bit about the type of health insurance plan that is being offered, right? So we mentioned this in our Millionaire game. We have the preferred provider organizations for 3 of the plans and an HMO type of plan for one of the Aetna plans. You can see that having a primary care provider is really recommended for all of those plans, but is actually required, right, for our Aetna plan. And as we look down the left-hand column here, we can see the services that are provided, and then across, if we read across, we begin to see what are the differences in those charges. One of the other things to notice here is also this in-network versus out-of-network row. And so for the basic gold plan and the PPO plan, right, you have an out-of-network option. And you can see that if you choose an in-network option, you're going to be paying less than if you choose an out-of-network option. And, that's pretty typical, right? Our only plan that doesn't really have a out-of-network option is the Aetna HMO plan. So again, as we sort of look at the different services on the left-hand side, you can begin to see the differences in the price or either the co-insurance or the co-payment that would be required. In terms of preventative care, right? All of our plans, thank you to the state for negotiating this, all of our plans are really cover preventative care, screening, immunizations, and things like that. And that really has to do with the Affordable Care Act, but also because of the great negotiating skills of our state insurance people. Notice that the deductibles are different depending on whether it's in-network or out-of-network, or whether it's individual or family. The other thing I'm going to talk a little bit more about is unique is this Aetna CDH Gold Plan, which has a health reimbursement account associated with that. I'm going to park that one and talk about that in a little bit. This next row has to do with what's called the out-of-pocket maximum. And an out-of-pocket maximum is exactly that, is when your out-of-pocket costs reach whatever this number is, then the health insurance company pays everything that's allowable, all additional costs, as long as it's an allowable service. In this Highmark Delaware First State Basic Plan, if you look at this, the out-of-pocket maximum is $2,000 per individual or $4,000 per family. So what does that mean? Well, that means once you have paid, right, the deductible, right, because it says including copays and deductibles, once you pay the deductible, which in this case is $500 per person or $1,000 per family, plus any of those copays or co-insurances, all of that adds up. And once you reach that $2,000 per person or $4,000 per family, the health insurance company will be paying the remainder of health care costs as long as it's an allowed cost. And so you can see there are differences across the plans for what those limits are. For other services, then we're starting to get into this idea of co-insurance versus co-payment. So I'm going to go down to this primary care visits to treat an injury or illness. And you can see for most of the plans, or the first 2 plans, there is a co-insurance. And for the last two plans, there's a co-payment when we're using in-network options. And so again, this is very predictable, right? An HMO plan, that co-payment is $15. For the PPO plan, it's $20 per copay. That's very predictable. We know what that is. It may feel a little less comfortable to have a co-insurance, which is a little less predictable. But that's also a matter of having a conversation with the healthcare provider to determine what your co-insurance cost may be if you use their healthcare services. This is the second page. There are 5 pages in this document, and this is really important to take a look at to kind of see what's being covered at how much. And obviously, one thing I do is I go through that white column there, that first column, and I kind of put a check mark next to the things that I typically need to use. And that's where I begin my sort of comparison shopping. So one of the other things that's really important to take a look at is sort of the details, right? And so for each of the healthcare plans, whether it's an Aetna or the Highmark Blue Cross Blue Shield, is to go to their kind of go one step deeper into the website to find out the summary of benefits and coverage booklet. It's a PDF file, obviously, and it will help you really understand the kind of the details of the plan, what's covered, what isn't. If you have a dispute, you want to find out some more information, how to access services, where to go for more information in terms of, say, who's in network versus out of network. Both of the plans have websites that you can also look up information in terms of networks and in networks and out of networks. But I would also encourage you to look at the summary of benefits and coverage. This is actually, the way I like to think about this is, it's actually the contract, right? This is the contract between you and the health insurance company, and it helps you really understand what the coverage is going to provide. So I kind of put off talking about the gold plan, but this is very a nice perk for state employees. The gold plan, the Aetna CDH gold plan, has a extra benefit, and it is called the health reimbursement account. And the health reimbursement account is a tool that the state is offering employees that helps to cover some of the deductible costs, right? The deductible is $1,500 per employee under this plan, but the health reimbursement account provides $1,250 for each employee to help cover that deductible. And so how does that work? Well, you would go right to the healthcare service provider. You may pay that bill, but then you submit the bill for reimbursement. So if I go to the doctor and they're charging me $100 and it's in the first part of the year and I have a deductible to pay, then I would pay that bill to the provider and then get reimbursed for that $100. And there's some rules about when you can submit and whether monies can be, well, I won't even say that. But what's nice about this plan is that it allows unused portions to roll to the next year. So say I had a healthy year and I went to had my preventative doctor's appointments, and those were covered 100% by the plan, and I didn't have any other need to access healthcare, and I am signed up for this plan, then that $1,250 rolls over to the next year, and I would then have $2,500 to help pay for healthcare costs. So that's really a great way to have kind of bank some money, for lack of a better word, so that when something more catastrophic might happen, or you need to have surgery or whatnot, that there is money there to help cover healthcare bills. That is only with the CDH, the Aetna CDH gold plan. So what about costs, right? So this is again from the website on the human resources page, and it actually helps us see what the total monthly premiums may be depending on what level of, not what level, but who you need to have covered within your plan, and then typically what the state what you would have to pay. And so you can really begin to then comparison shop across the different plans. And as you can see, the Highmark First State Basic Plan, if you just look from the employee perspective, that is really the least expensive plan. And you can then compare across the plans in terms of costs. I guess, just from an interactive perspective, how do the charges compare across the plans, and what factors do you think kind of contribute to those differences in total cost? So those are the two questions. How do the charges compare, and what factors contribute? So if you just look at the deductible, so one of the big differences between the plans, right? Certainly the Highmark First State Plan has lower deductibles. The PPO really doesn't even have a deductible, right? If you're in state. So that's also part of the consideration. So you may be paying more, right, per month for your PPO, but you're also that $500 deductible, right? So, I mean, you're right. It's sort of like looking at the trade-offs, right? Based on how you're using healthcare, what are the trade-offs in terms of premium, deductible, potential out-of-pocket costs versus frequency of using services. The other thing that I also hear people share with me is they like a lot of predictability. And so for some people, having a co-payment amount is more comfortable than a kind of a co-insurance amount when they don't really know what that is going to look like, right? So in order to kind of mitigate that, having conversations with your healthcare providers about what that would be before you have to access service is another way to help you plan what your out-of-pocket expenses might be. Here's sort of a summary of the kinds of things that you do need to consider, right? So what are our healthcare needs? How frequently do you go to the doctor? How do I want to say this? Some families are always going to the doctor. They're just, prone to accidents or have ongoing or chronic illness, right? And so a type of person may need a different kind of person, or sorry, a different kind of plan than someone who, who's healthy, right? So that's the first thing. What are our needs? Who do we need to see? How often do we need to see them? What are some of the costs, right, as they relate to the healthcare system and the use of the healthcare system? Understanding the different kinds of plans and how that allows you to access, or how does that impact your needs? For example, some people really want the ability to go to Pennsylvania or Maryland to kind of get a second opinion in some of those healthcare services. And so having then the ability to go out of network and have some of those costs covered may be really important to you. Understanding what the preventative services are covering and what they're not, that's important. Typically that preventative doctor visit, right, is covered, but if there's laboratory tests or follow-up visits, that would not be considered preventative then, and then you would be responsible for those, right? And then how do those healthcare costs fit into your spending plan? And so all of those are really things to consider. And one of the things I wanted to introduce you to is this Smart Choice Consumer Workbook. Again, this was sent to you. I am going to kind of quickly go through a few of the pages in this book. And so this is the cover. I got to help co-author this, and so I know it pretty well. But there's a whole bunch of information sort of in the first few pages, and then as you move forward, it gets into worksheets that really can help you get organized. And so this is one of the ones that helps you think about what are our needs, how often do we visit, who are the kinds of doctors we see, how often do we see them. One of the things that I also like about this, and frankly it was my idea, pat on the back, right, is this important words to know that's right there on the page. So if there's things that could be confusing or you're not sure of, it's right there on the worksheet page. So first thing is, who am I seeing, how often? The next few pages are a little bit more that help you kind of comparison shop across plans. And so you can see the first column is those important things to consider. And then the second, third, and fourth are options for analyzing up to 3 plans that you might be comparison shopping across. And there are several pages there that kind of gets you to look at, kind of go deeper than even what might be in the document, kind of the overall document that the state provides. It may mean going into that summary of coverage and benefits to have a better sense of really what is covered. The other really cool tool here is to begin to get you to think about what are those out-of-pocket costs, and looking at, okay, so what is that annual premium? What is that deductible? And then based on my needs, right, how many times did we go to the primary care? How many times did we go to the specialist? You know, how many times did we go to the urgent care? Let's begin to really crunch the numbers, right? So for if we go to the primary care 4 times and the copay is $20, then that's $80, right? And we really begin to crunch the numbers to compare across the plans. After you do that for the plans, then this is a place to kind of begin to summarize, not only for my insurance plan, but a prescription drug plan, vision, and dental, right? So there's a chart like that for each of those different kinds of insurances. So you begin to see not just my health insurance plan, but these other types of insurances that may help cover healthcare costs. So you can begin to really see what is the healthcare costs across all the plans for me and my family. Also in this book is a monthly spending plan. And so this is just a tool. You know, I come from a finance background, and so it's a plan to help us get organized about how covering our healthcare expenses fits into the whole plan. And so there's a place here where we can kind of look at, you know, what are our wages, what's coming out, you know, what's the housing and other important expenses. And you get to the second page and, whoops, I don't have it. I put the second page there. That's where it's got all the healthcare pieces. And then how do you compare, right? The kind of what's coming in and what's flowing out. And how do we make it work, right? Are there things that we need to consider cutting in order to be sure that we have our health insurance coverage the way we need it? So that tool is in that workbook. And so these are the questions we've kind of gone through, right? Why do I need health insurance? What are some things I need to consider? What are the options that I have? And, you know, and how do I choose the right plan? And you put all those together and you can make a really good, smart choice for yourself. One of the things I wanted to also point out is, you know, the department, the Human Resources Department at the state, but also within our systems, right? So the Human Resources Department at the University of Delaware, for example, they've got great resources. This is the kind of a snip of the HR department, the Department of Health, Human Resources for the states. A way to, they've organized information. They do have some online courses that you can take that are great. This is where I found the health plan comparison chart if you need to take a look at that. There's other kind of enrollment tools here that you might need to consider. And here are sort of a preview of the rates. So there's lots of information right here on this page that can be very helpful. Here's some additional resources. This was in the list that I sent to you. It includes the Delaware Department of Human Resources enrollment pages. It includes some information from the University of Delaware Extension, as well as Maryland Extension. Healthcare.gov, I have to say, is a really great website for sort of some of the basics in terms of health insurance. They've done a really nice job. And then I included the IRS here because oftentimes I get questions about, well, what if I have a catastrophic something and my healthcare costs are really high, and can I deduct some of those medical expenses? And so that's what this IRS publication will help you kind of learn more about. All right, well, I hope the resources are helpful to you. My contact information is on much of it, so if you need to get a hold of me, please feel free. I'll encourage you to go to that URL and take my little post survey. It really helps me improve what we're doing. And I thank you very much for attending, and I guess that's it. Thank you.